Hi guys, my name is Karina Pena, and today I will be talking about immunological thrombocytopenia purpura. Typical patient presentation. A 45-year-old female presents to her physician with a fever, bruising all over her arms, and an abnormal rash on her legs. She tells her physician that she has been bruising suddenly with no strenuous activities being involved. She has been having blood in her stool and urine for the past few days, as well as bleeding in her gums. She reports to him her history with rheumatoid arthritis. Etiology of the disease. So, thrombocytopenia can actually run through family, but you can also get it from medical conditions. It occurs when immune system accidentally attacks platelets that help with blood clotting. Secondary ITP can be triggered by viral infections such as hepatitis, HIV, and chickenpox, and as well as sepsis, which is a severe bacterial infection in the blood, and also Helicobacter pylori, which is bacteria that can live in the digestive system. In children, mumps or flu are present before ITP, and it affects women more than men. This is just some background information on ITP. Defined into clinical syndromes, it was defined into clinical syndromes in the 16th to 18th centuries. Microscopic science was advancing during the 19th century, and that's when the platelet was actually recognized and named ITP. There are about 200,000 affected with ITP worldwide, and it affects people aged 30 to 60 years old of age the most. And of course, like I mentioned before, women are affected twice as much as men are. Some of the risk factors, including ITP, side effect from bone marrow transplant or infections, connective tissue diseases such as antiphospholipid antibody, which is, an autoimmune disorder system that attacks the phospholipids, and also systemic lupus erythematosus, which is also, an autoimmune disease where immune system attacks its own tissue, which causes a widespread of inflammation to tissue damage in the affected organs. Evans syndrome, which is known as an autoimmune disorder in which the immune system destroyed red blood cells, white blood cells, and platelets. Common variable immune deficiency, which impairs the immune system and is highly susceptible to viruses and bacteria. Now, this is just the pathophysiology of ITP. Causes low blood levels of platelets, which, these platelets help with blood clotting in the body. The body produces antibodies that attack and destroy the platelets. Antibody platelets bind to antigen-presenting cells such as dendritic cells or macrophages, then are degraded. Antigen-presenting cells create cryptic epitopes from platelet glycoproteins. The antigen then presents cells, they become activated and express the peptides of the surface of the cell. Then the cytokines, they make it easy for proliferation of CD4 positive T cell clones, as well as the ones alike to them, which are the T cell clone 2. The B cell receptors recognize the other platelet antigens, B cell clone 2. They are produced to proliferate and synthesize the IB or IX anti-glycoprotein antibodies to increase the production of more anti-glycoproteins, or ALLA or LLB antibodies by the B cell clone 1 cells. Some of the symptoms include bleeding from the nose and gums, long time periods of bleeding from injuries or cuts. The blood is lost there. blood in stools and urine, superficial bleeding, and just, lots of bruises. Diagnosis. So, some of the questions a doctor might ask a patient with ITP is what symptoms, including bleeding, might the patient have noticed about themselves, or, they might ask when they first saw those symptoms appear, if there's anything that's making it worse or better. He will also ask about the family history with a problem in their immune system, like any bleeding or any bruising. So just some of the diagnoses that I've found, which one of the ones that I found were complete blood count, and that's number, size, and maturity of the blood cells and volume of blood to measure platelets, urine and blood test, routine blood test, which is, one of the tests that they use is named anti-platelet antibody test, which is utilized to measure the bleeding time, and infections can be detected here as well. Blood smear, platelets are shown under the microscope. The bone marrow aspiration test is used to detect any odd cells that are the cause of lowering platelet counts, as well as examines, the platelet production. Some of the treatments that I found online were actually lots of them. Here are just some of the ones that I've listed. But in some cases, treatment isn't really necessary depending on how mild the disease is. Steroids. It reduces platelet destruction by preventing bleeding from occurring. Intravenous gamma globulin, which decreases platelet destruction. It is a protein that releases antibodies. Medicines such as Prolacta and Nplate, which, these stimulate the bone marrow to produce more blood platelets. Splenectomy, which is the removal of spleen, and this helps to lessen the destructive platelets. Others include Rh immune globulin, which stops the spleen from destroying platelets for a while. But you have to be Rh positive in order for this type of treatment. And the last one I have listed here is the infection treatment, which is treating the infection that is present and causes higher blood platelet count. Also, I found that corticosteroids are, they're like tablets, pills, and which also help with the raise of platelet counts. And like I mentioned, there are many treatments for ITP, just so many. And well, obviously, once consulting your doctor, they will know what type of therapy is best for you. For example, if it's mild, you may only need regular checkups with your doctor to check your platelet levels. And of course, you always want to, take care of yourself for a better change of lifestyle to prevent getting hurt easily or, cuts. Eating lots of fruits and vegetables, especially leafy greens, so that the body gets those important nutrients it needs. Asking your doctor for the types of food you should eat. That's probably a good idea, just so that you would know what type of diet, you're supposed to be on. And there are also support systems, such as the Platelet Disorder Support Association, which has a lot of information, and actually a lot of people use it with, just to talk with other people that also have ITP. So that's also useful. And that's all. Thank you for